Hello everyone, in this video we are going to discuss about hypothyroidism. How can we treat hypothyroidism? For this we have to know about when to start and how to start the thyroid drug, that is levothyroxine. It is the synthetic form of T4. We have to check first of all TSH level. The normal is 0.5 to 4.5. If TSH is high, then we should go for free T4 level. If free T4 level is normal, then we call it subclinical hypothyroidism. But if T4 is less, we call it overt hypothyroidism. The ultimate treatment for overt is start levothyroxine. But if the patient has subclinical, age is less than 65, then we should check TSH again after 3 months. And if it is more than 10, then we should start levothyroxine. But if it is from 4.5 to 10, we should not start. But if the patient has 4.5 to 10 and anti-TPO positive, multiple symptoms of hypothyroidism, pregnancy, or they are planning for pregnant and goiter, then we should go for thyroxine. And if the age is more than 65 and TSH is less than 10, then we don't require treatment, because over treatment of the hypothyroidism might result in cardiac arrhythmia, so we should be aware of that. But if the TSH is 10, then we should treat with levothyroxine. As I mentioned earlier, over treatment of hypothyroidism might result in cardiac arrhythmia, increase in the heart rate, and the heart failure. We have two methods for treatment. One is full replacement and other is partial replacement. Full replacement means 1.6 mcg per kg per day, about 100 to 150 mcg per day. We should titrate by seeing the TSH level. We should repeat every 2 months, and then every 4 months we should titrate by 12.5 to 25 microgram. And most popular method is partial replacement dose. We should start with 25 for 4.5 to 8, 50 for 8 to 12, 75 if more than 12. We should titrate every 2 months, and we should check for heart rate while giving the thyroid hormone. If the heart rate is within 25% of its normal, either increase or less, it is usually normal. But if it is more than 25%, then we should be aware of that. Now let's see some of the conditions. Like if there is less TSH, low T3, low T4, it might be due to the secondary hypothyroidism, means problem in the pituitary glands, or tertiary hypothyroidism, means problem in the hypothalamus. And we have another conditions called sick euthyroid syndrome, in which there is normal amount of the TSH and T4 but T3 is low. It occurs in starvations or critically ill patients. But if the patient has less T4, less T3, normal TSH, this refers to the poor prognosis. Let's see how to take these medicines. We should take 30 to 60 minutes before the breakfast. We should take separately from interfering drugs like PPI, calcium salts, ferrous sulfate. Steroids also interfere with the metabolisms of the levothyroxines. If we fail to treat, then there might occur complications like myxedema, coma, and encephalopathy. We should treat myxedema, coma by T4, which should go for IV 200 to 400 mcg, then 50 to 100 mcg daily until the patient can take orally, or T3 5 to 20 mcg 8 hourly. We can go for 8 hourly. But if the IV dose is not available, then we can go for orally 200 to 400 mcg for treating the myxedema, coma. And we can find a swan wave in ECG. In echo, we can find pericardial effusion and diastolic failure. In chest X-ray, we can see bilateral pleural effusions and cardiomegaly. Level of the T3, T4 and TSS are not maintained after giving the thyroid hormone supplementations, Then we should check the magnesium level, TSS resistance, and correct the magnesium level if it is low. As we know, misuse of the thyroid hormones for weight loss is very popular in healthcare workers, especially the nurse. They take thyroid hormones for losing their weight and to look attractive. We should be aware that hyponatremia is so common in hypothyroidisms. If there is acute hyponatremia, then it might be due to the acute hypothyroidism. We should be aware of that. It is due to that TSS results in the body fluid levels, so resulting in the hyponatremia. And if the patient has hypothyroidism, it might be the candidate for diabetic mellitus because both are the autoimmune conditions. So that's all about the video. Thank you.